Good evening, everybody. Thank you so much for joining me for this presentation about eating disorders in the Jewish Orthodox community. This is Eating Disorder Awareness Week, so it's an appropriate time for this particular webinar. I hope you find the presentation both informative and helpful in your understanding of eating disorders. I am Marcy Forta, and I work in eating disorder awareness, education, and prevention. If you ever need to reach out to me, please feel free to do so. Go to atzmi.org or marcyforta.com. Okay, let's get started. Here are some of the topics we'll be covering today: the prevalence of eating disorders, what they are, who's at risk for an eating disorder, how we might recognize a potential eating disorder, and as parents, what we can do to keep our children and daughters safe. What should we do if we suspect a problem? And then at the end of the session, I would love it if you guys would put some questions in the chat, and I will address as many of them as I can. When the email went out originally, for some of you, it says that the webinar is from 8 to 9:30. It's actually from 8 to 9. So I'll speak for about 45 minutes, and then we should have plenty of time for some questions. All right, let's start with some statistics. Between 9 and 12% of people in the United States, that is 29.8 million Americans, and estimated to be about 70 million people worldwide, will be diagnosed with an eating disorder in their lifetime. And this is really only referring to those with a diagnosable disorder. It's not indicative of how many people are struggling with food and eating in general. And the statistics show that 95% of those who have eating disorders are between the ages of 12 and 25. Eating disorders have the second highest mortality rate among mental illness in adolescence, really second only to drug overdoses. Eating disorders show stronger relations to things such as mortality and suicide attempts, even functional impairment, even psychiatric disorders, including schizophrenia, major depression, and bipolar disorder. And they are the second leading cause of mental health disability, both for adolescent girls and young women. One death every 52 minutes, that is 10,200 deaths each year, can be attributed directly to an eating disorder. About 26% of people with eating disorders attempt suicide, meaning they are 11 times more likely than the general population to attempt suicide, someone who's struggling with an eating disorder. Females are twice as likely as males to develop eating disorders. Eating disorders have been diagnosed in children as young as 5 years old. And yes, that means there are 5-year-olds that are in inpatient facilities with a clinical eating disorder diagnosis, and as old as 80. And actually, there's anecdotal evidence that women in hospice, that is end-of-life care, when offered a decadent or fattening dessert or something that they think they shouldn't be eating, they'll refuse it because they think they shouldn't have the fat or calories. And this really demonstrates just how deep-seated some of our body image and appearance ideal issues are. It's actually quite devastating to see how prevalent and rooted these issues are and have become. Over 70% of adolescent girls don't like their bodies. I'm leaving that there for a second because it's a massive number of people, 70%. And 81% of 10-year-olds are afraid of being fat. 80% of 13-year-olds have attempted to lose weight. 50% of girls between the ages of 11 and 13 see themselves as overweight. 35% of 5-year-olds are already restraining their food intake in order to lose weight. 42% of 1st to 3rd grade girls want to be thinner. And between 35 and 57% of adolescent girls have engaged in some form of crash dieting, laxative use, diet fasting, self-induced vomiting, in order to lose weight. Sadly, many mental and physical health professionals really have little or no eating disorder training. Now, there is scientific evidence that eating disorder treatment that is conducted by trained specialists is far more effective and successful. It is so imperative then to get help from somebody who is trained and experienced, and to get that help as early as possible. A therapist who can only help with the comorbid conditions, often eating disorders go hand in hand with depression, anxiety, or OCD, are simply not enough, and they can actually prove harmful for someone who has an eating disorder. Now, I totally understand the need and value of a from therapist, but with eating disorders, you simply have to go to someone trained in the modalities of treatment that are needed. The success rate is much higher for interventions that are appropriate to eating disorders. Sadly, studies show that between 80 and 90% of adolescents with eating disorders do not receive treatment. That means less than 1 in 5 who are struggling with an eating disorder have received treatment for it. But what about the statistics of our community? Well, due to the insular nature of our community, there's not a ton of empirical study overall, but there are several studies, as well as considerable anecdotal study, that have found that Jewish Orthodox females may be twice as likely to develop an eating disorder, twice. So that's above what we talked about in the beginning, the 9 to 12% of the 9% of regular society and the 12% of all females. So between 18 and 24% of us will be affected by an eating disorder during our lifetime. That's a lot of people. And although we work to be as insulated and isolated as possible, the reality is that Western culture has had a real and measurable impact on our community. And trying to balance these secular ideals with our religious beliefs, along with our cultural and environmental considerations, can increase risk as well. Fear of stigma does prevent people from seeking help. And while there definitely has been improvements in the acceptance of mental health treatment overall, sadly, it is still quite stigmatized. And as you see, it is an impediment to the early detection and successful treatment for all mental illness. But in the frum community, actually, eating disorders are even a greater source of stigma. So while disordered eating is often looked at as something positive, if the outcome means that the person will become thin or look more socially acceptable, but when it crosses over to a clinically diagnosable disorder that requires treatment, the stigma is greater. Another source of stigma for mental health treatment in general has to do with the fear that treatment may undermine the patient's faith or observance. And this can prevent people from getting help. And this is a significant barrier to treatment for any mental health issue, even some physical health issues. I have heard of mothers who don't want to get speech therapy or help for their child with a learning disability because they think it might reflect badly on them or their siblings down the road. 60% of Orthodox Jewish mental health professionals believe that our community is underserved regarding mental health treatment. 85% of them believe that it's due to the stigma surrounding mental health. So we have established that eating disorders are prevalent, they are widespread, they're deadly, stigmatized, and onset can be at very young and impressionable ages. What then are some of the costs and consequences of eating disorders? So eating disorders have costs that are physical, emotional, and societal. In fact, the total economic cost is estimated to be $64.7 billion annually. I'm not going to go through the costs. I'm just going to leave them up there for you to look at. But eating disorders in general do not affect only the person who is struggling with the eating disorder, but their entire family and society is affected from them as well. So let's define what we are talking about when we speak about eating disorders. What are they exactly? Eating disorders are severe illnesses. They have a very complex onset that are thought to be a mix of biological, psychological, and environmental factors. They're often chronic and can result in a significant reduction to a person's quality of life. They have comorbidity, high comorbidity with other mental disorders. So they usually go hand in hand with other mental disorders, and they have significant treatment resistance because they are difficult to treat. In an eating disorder, food is used as the vehicle to express the disorder, but it is not the cause of the eating disorder. Food actually helps the person who is suffering or struggling with the eating disorder give voice to any kind of inner emotional turmoil or struggle that they're going through, and helps the person express their emotions because they're often too complicated for them to articulate and share. Now, as eating disorders are so difficult to treat, and people who struggle with them might still struggle many years after diagnosis, they often actually require teams of people to treat them. You have doctors, mental health professionals, nutritionists, dietitians. And so beyond needing a team of people, they also require several modalities of treatment as well. So there are different types of treatment that they might require. It's also important to note that BMI, body mass index, is not a fair or informed indicator of whether someone is struggling from an eating disorder. So the following are the types of eating disorders that are listed in the DSM-5, which is the standard classification of mental disorders that is used by mental health professionals in the United States. The first one is anorexia nervosa, probably the most known eating disorder. It's that persistent restriction of food with an intense fear of gaining weight. Most of the time, these individuals present with a body weight that is below kind of a minimally normal level for their age, their gender, their physical health, their developmental trajectory, but that's not always the case. You simply cannot determine if someone struggles with anorexia based on their appearance alone. And then there's bulimia nervosa, which are recurrent episodes of binge eating. So basically, it's the intake of excessively large amounts of food during which the person who is doing this feels a complete lack of control over their ability to stop themselves from eating. And they follow these binges with compensatory behaviors, things such as extreme exercise or laxative use or self-induced vomiting. And in order to be diagnosed with bulimia, you have to engage in these behaviors at least once per week for a minimum of 3 months. Then there's one called binge eating disorder. So this differs from bulimia in that there's no compensatory or inappropriate behaviors after the binges. So they experience the binges where they have that loss of control and the excessive amount of foods, but they don't do anything afterwards. And it doesn't occur exclusively during anorexia or bulimia episodes, but also like binge eating, like bulimia, must occur once a week for a minimum of 3 months. There's one called avoidant restrictive food intake disorder. This is also known as ARFID. Sometimes this is characterized as extreme picky eating by children. Most people with ARFID have a genuine lack of interest in eating and food. They get full quickly, they have sensory issues, they have issues with the taste of the food, the smells, the textures, the temperatures. They have a fear of eating because they think they're going to choke or they're going to get nauseous or get sick. And then finally, the last disorder is called other specified feeding or eating disorder, known as OSFED. People with OSFED commonly present with extreme disturbed eating habits. They have a very distorted body image. They overvalue their body shape and weight, and they have an intense fear of gaining weight. So some actual examples of OSFED are something called atypical anorexia, which is someone who exhibits all the typical symptoms of anorexia nervosa, but they're not underweight actually. Or purging disorder, where they do the compensatory behaviors, those behaviors we talked about, like vomiting, self-induced vomiting, laxative use, or extreme exercise, but there's no binge beforehand. And there's one called orthorexia nervosa, which are just kind of obsessive behaviors around healthy foods. So perhaps they strictly avoid foods that they believe to be unhealthy. Maybe they will only eat all foods that are organic, or they won't eat food that has preservatives or is manufactured. It's a very severe use of health food. And actually, OSFED is the most common eating disorder that is diagnosed both for adults as well as adolescents. It affects both males and females, and it is followed by binge eating disorder, then bulimia nervosa, anorexia nervosa, and then ARFID. I think people often think only of anorexia when they think of an eating disorder, but as you can see, that's simply not the case. The reality is that anyone can be susceptible to an eating disorder. And oftentimes those people who are in larger bodies may be marginalized and not looked at for an eating disorder. But a person in any size body can struggle with an eating disorder. So what are people struggling with when they have an eating disorder? What are they contending with? How can we better understand the internal dialogue and the struggle? So I use the word or the phrase internal dialogue very purposefully because there is actual dialogue going on between the person who's struggling with the eating disorder and something called the eating disorder voice, which is a very real and powerful force. It's kind of like an inner bully where it's very demeaning, it's nagging, it's hateful, it's controlling. If you or I spent even 5 minutes alone in the room with it, we'd run away. It's a very powerful voice. But for people struggling with an eating disorder, they often are struggling with this 24 hours a day. So that means even when they're sleeping, they're hearing this eating disorder voice. The dialogue that they say to themselves includes a tendency to judge their entire self-worth on their weight and shape and their ability to control their weight and shape. They over-scrutinize every part of their body. So either they might constantly check themselves out in the mirror, they might compare their bodies with other people. Some people have a complete irrational fear of gaining any weight whatsoever. And some people actually won't even look at their body at all because they feel that they're just so physically repulsive that they shouldn't even look at themselves. If they can't find a way to control their eating in a way that feels successful to them, then they experience feelings of worthlessness, insignificance, unworthiness. And finally, the stress on weight and shape kind of manifest differently for different people, but some will check weight obsessively, while others will absolutely not be able to get on a scale. So why do some people develop an eating disorder when other people do not? And they might be in a similar circumstance or life situation. Let's talk about some of the risks for eating disorders. The first risk is a genetic predisposition that might incline someone to have an eating disorder. Very interestingly, there's currently a worldwide study that is looking into the types of genes and specific genetic variations that can lead to eating disorder predisposition. So according to this study, between 40 and 60% of the variability in eating disorders is inherited, 40 to 60%. So knowing this alone can actually help significantly reduce the stigma that is attached to being diagnosed with and getting help for an eating disorder, because a huge part of the eating disorder then is genetically predetermined, much like other genetic susceptibility disorders such as celiac disease, Crohn's disease, even high blood pressure. So this means in the future, there could be treatments that are developed and tailored to the specific genetic variations of each person. Currently, there's not much in the medical realm that is consistently successful in treating eating disorders. So this is very groundbreaking stuff. There are familial risk factors, mothers, fathers, siblings, grandparents, aunts, uncles, anyone who has a family connection. This is actually a significant risk factor category, and we will revisit it a little bit later. And then we have the social kind of societal body ideals and appearance ideals, unrealistic expectations that we get due to social media. These concerns can influence inappropriate dieting and food behaviors, as well as lead to social appearance anxiety and just an intense fear of gaining weight. We find them on social media, in magazines, clothing store mannequins. We get them from our peers. Really, whatever society dictates is attractive and desirable, those are our social ideals. And then there are some personality traits that actually increase risk for an eating disorder. Someone who struggles with perfectionism. That is a particularly difficult trait for eating disorders. Someone who has negative emotionality, that means they are more fearful or angry or sad in general. Somebody who has behavioral inflexibility, so they're a little bit of a tougher personality, or people who are more shy and inhibited in general are also more prone. Some psychological risk factors. Any early adverse psychological trauma or experience is a risk. Any psychological disorder, including anxiety, social appearance anxiety, depression, OCD, are all risk factors. Someone who frequently diets or has recently significantly gained or lost weight. Being female is actually a risk factor. Having food insecurity and age. Life stage, we talked about age. The age of adolescence is a risk factor. So let's talk a little bit about adolescence, because it's a time of tremendous change and growth. There are more mental health issues diagnosed in adolescence than any other life stage. Adolescents are developing their own thought and belief system, and they're fostering their own independence. They're working to create and solidify their own personal relationship with Hashem. They're undergoing many physical and emotional changes that greatly influence them throughout this stage. As you see, it's a critical developmental phase. Their brains are maturing as well, and there is an increased need for energy and nutrients. So any period of time during adolescence where there's a reduced nutrient intake can actually cause cognitive, which is like mental impairment, thereby also increasing risk. Adolescents have a difficult time reflecting on their emotions and understanding them and being able to communicate them. They're more impulsive. They're prone to quick or knee-jerk decisions in order to maintain feeling that they're in control of their decisions and choices. And it's a time of their social identity formation. Social identity really becomes a reference for a person's self-worth, and it's based on their interactions and their shared perceived kind of goals within their community and the members of the community. So we see adolescence as a huge time of transition, and it's often filled with just stress and anxiety as the adolescent endeavors to develop and advance their own individuality. But what are some of the specific, from Orthodox Jewish risk factors that are above and beyond the general ones? We talked a little bit about stigma before. It is a significant category of risk. But there's also a fear of religious and spiritual questioning. Girls feel afraid that they will be viewed as rebellious if they have any religious or spiritual questions or concerns, which can kind of make them not want to raise them or question things. Privacy, in general, we are a very private people. We encourage keeping things more private and secretive. This leads to increased risk. We also don't encourage asking for help often. It can sometimes be even discouraged or considered negative. And weight. There is a lot of stigma against those people who are considered or viewed as overweight. Studies have found that heavy students from nursery all the way through college experience ostracism, discouragement, and sometimes even violence. And of course, we talked about the fact that there's more stigma surrounding eating disorders than any other mental illness. And then there is the category of mixed message perception. So while messages we give over may be intended differently to our children, it's really how they internalize or perceive them that is what is relevant or significant. So we often speak about and we emphasize neshamas and our internal connection to Hashem, but there's nevertheless a lot of stress on externals and physicalities. We talk about looking good, being thin, getting into the right schools, marrying well, just a couple of examples. There are shidduch messages and standards that can be very stress-inducing, confusing, and damaging for the girls. And then we talk a little bit about tznius. So when the girls only hear or internalize the physical messages of tznius and don't understand and reflect on the beautiful hashkafa that goes along with it, their risk is also increased. And the idea around shame, around physical body development. We often don't speak nearly enough about our physical bodies, how they grow and how they develop, what is normal, what is expected regarding our bodies and our feelings. And then, of course, food, which is a very complicated subject. As you all know, we are religions surrounded by food and eating. And this is really difficult for even the least obsessed body-obsessed individuals. So for somebody who's struggling with their body image, Shabbos, Yom Tov, Simchas, parties in school can all create great stress, confusion, and lead to increased risk. Oftentimes we give confusing messages to our kids. How much food is too much food? Our girls should be able to cook well, but not eat too much. They should be able to bake, but they shouldn't really partake of what they bake. How families use food in their home. Is it a reward? Is it a punishment? Or is it a tool for our health and growth? And then the concept of control. So mothers are often the people who shop and cook and kind of have control over what the girls eat. And this is mostly for pre-high school girls, but this can create stress and confusion for the girls because they feel kind of forced to eat whatever is given to them. But we're going to discuss this a little more later on. And then the family unit, we did mention this before, and I told you we'd talk a little bit more about it, another complicated and influential risk factor. So modeling, how we model our behaviors to our children. There are many dynamics between mothers and daughters, how mothers model their food and body image behaviors, their own self-talk, how fathers speak to their daughters about their appearance, how siblings experience things and speak to one another. There are grandparents who literally pay their grandchildren to lose weight, or mothers who don't let their daughters eat what the rest of the family is having because they want them to lose weight, or mothers who won't take their daughters clothes shopping when they get back from seminary if they gain weight during that year until they get back to their pre-seminary weight. And also there's a lot of praise and reinforcement for people who lose weight. It's such a good thing, and we talk about it so positively. So these are just a lot of the places where the messages can cause some increased risk. And then we have some specific pressures. So our girls experience pressure in many areas. Any constant and significant pressure can be both damaging and harmful. We have perfectionistic pressure, that need to be perfect, the superwoman ideal that you can do it all, have it all, and do it all very well. We have academic pressure, get good grades, get into the right schools, get into the best seminaries to get the right shidduch pressure, which is a category of its own, and then peer pressure and that pressure to be thin. And then finally, the idea of homogeneity expectations. This is kind of an overarching theme and factor for our girls, because our girls often feel that they have to aspire to and accomplish what it is everyone else is doing. And so it becomes a struggle for them to assert their independence and develop their own unique talents and abilities. And this can be very difficult for them to overcome. So before we talk about what we can do to help head off these disorders, we're going to talk about how we can recognize an eating disorder. How do we know if someone might be struggling with an eating disorder? These 4 questions are a very good starting point to delving into someone's issues with and around food. Does eating cause them anxiety? Do they try to control their weight by restricting, purging, or over-exercising? Are they unhappy with their body? Do they feel that their life is dictated by thoughts of food? I have a colleague that I work with who developed something called the mind-share continuum. And the idea is that the more your brain is filled with thoughts of diets and calories, food, body shape and size, weight, the less space it has for other more important and valuable topics. These eating disorder thoughts can just consume someone's life and leave very little or no space for other thoughts. But there are also many physical and other types of signs and symptoms of eating disorders, and they can overlap with other disorders as well. So it's really important that you analyze them in context with what the person is experiencing and in tandem with one another, because eating disorders can actually affect all organs and systems. And it's also really important to note that less than 6% of people who are diagnosed with eating disorders are also diagnosed as underweight. So you simply cannot always expect to see someone who is struggling with an eating disorder. And people in larger bodies are half as likely as those in a normal weight or underweight to be diagnosed with a disorder. So we did talk a little bit about the whole body signs and symptoms. Then there are some behavioral symptoms. Are they completely preoccupied? Do they refuse to eat certain foods, skipping meals, or only eating at certain times? Are they uncomfortable to eat around other people? Did they institute any new food rules or practices? Do they hide food or wrappers? Have they had any noticeable extreme fluctuation in their weight, extreme weight gain or loss? Are they more withdrawn from their usual friends and activities? Do they have extreme mood swings? Do they seem to feel disgusted with themselves, or have their low self-esteem seems to be tied to their body image? They might have stomach cramps, bloating, vomiting, pain with eating. And often they have difficulty concentrating. They start to feel cold. And some of them actually develop some sleep issues. They might develop some menstrual irregularities or stop menstruating altogether. You might have some abnormal lab findings. They might experience dizziness, dental issues. Some people get hand sores from induced vomiting, lowered immunity, frequent trips to the bathrooms, extreme exercise. Really, they just have overall impaired functioning because eating disorders pushes out all quality of life. And sadly, eating disorders do not develop in isolation. They're often accompanied by other disorders or conditions. So up to 83% of those diagnosed with an eating disorder also meet the criteria for a co-occurring anxiety or other mental disorder. So as you can see, it could be a depressive disorder, it could be a smaller social network, which really just points to the fact that they become less socially active. They become more inhibited and inward focused. They might have difficulty with social functioning. They start finding it difficult to communicate and share with others. Any anxiety or mood disorder or chronic mental issue. As we said, the consequences affect every aspect of a person's life. And the person suffering from the eating disorder is not the only person who struggles. It can be felt by everyone in their family because they become so detached and disconnected and solitary. A couple other high-risk situations that could lead to an eating disorder to keep in mind is anyone who's going through a key transition period or a big life change are susceptible to developing an eating disorder. Anyone with certain medical morbidities, people with a family history of an eating disorder, someone who is particularly exercise-oriented or plays a lot of sports, and then anyone who seeks help for losing weight. As eating disorders are really devastating and complicated, the key is prevention. And research shows that it works, but it has to be focused on building self-compassion, self-esteem, positive body image. 76% of kids who learned about body confidence felt more positive about themselves overall. But it needs to be tailored to the community. It has to be meaningful and appropriate, cognizant of the sensitivities and culture that the program is dedicated to. And so adolescence is actually the best time to implement prevention programs. It has the best chances for long-term success because during adolescence, health expectations and perceptions are still changeable. So it must be very tailored and it must be during this life period. And of course, the focus has to be on positive things: self-acceptance, lowering body and weight stigma, reducing self-criticism, increasing self-compassion. Any and all behavior that is punitive or judgmental has to be reduced or eliminated. So what can I do today that can help my daughter increase the mindset and skills that she might need in order to help her offset any kind of eating disorder or feelings of body shame or body image issues? So the first and foremost thing is we must change the conversation. We have to stop focusing on external. What we look like is not as important as who we are. It's not as important as our relationship with Hashem is, what we do, how we live our life. We teach our children the chiyuva, v'ushmartem es nafshoseichem, and yet we often model and reinforce the importance of what we look like on the outside. We compliment people for their clothing, their hair, if they lost weight, all external things, instead of focusing on their midos or their talents or their qualities or accomplishments. And we have to use food as fuel. It's nourishment. It sustains us. We need it several times a day, each and every day. Food should not be used as a reward, not in school, not for losing weight, not for going to camp, not for anything. And likewise, food should not be used as a punishment. You can't say you can't eat this food until, or you can't do this thing until you lose a certain amount of weight. Food needs to be used as a tool for our health, and it has to be recognized as such. When you use food as a reward or kind of a reinforcement of a behavior, you undermine healthy habits. And this can potentially disrupt a child's ability to accurately recognize or respect their hunger and fullness signals. And this can make food really about feelings of achievement and an alleviation of negative emotions. It's so important to avoid using food as a reward, because the short-term incentive of the food can actually have a long-term effect on the child's relationship with food. And then the child becomes reliant on the food to soothe themselves and regulate their emotions. Also, don't make food about morality. Don't call it good or bad. Then there's a lot of judgment surrounding it. Make it more about moderation and balance. Focus on healthy habits. So talk about moving to make us feel good, to increase our oxygen intake, to making choices that support our growth and our health. We have to listen to our body about what it needs. So we have to be really careful about how we speak to our daughters about food, what they eat, how much they eat, and what they weigh. And we have to talk about our bodies as gifts from Hashem, how each of our bodies was created with unique jobs. Each aspect of our body was created with a unique job and a purpose. Our brains, our eyes, our feet, our legs. We have to focus on what our bodies do for us each and every day, and less on the size of them and more about what they do. And then it's really important for you to get help with your own body image or food issues. Kids respond to modeling, as we mentioned before, and they pick up cues that are not verbal. So if you're struggling with your own food, weight, or body image issues, your daughter will pick up on this and she will be affected by it. So take care of yourself and get the help that you need. It's really not just for yourself, but for all your children as well. Stop judging people based on their weight or shape. Weight bias causes measurable, often irreparable harm. It has been associated with adolescent depression, substance abuse, disordered eating, suicidality, eating disorders, even eventual weight gain in adulthood. Parents and educators, health providers, we have all been guilty of this at one point or another, but we really need to stop doing that. And talk to your kids about the dangers of social media and comparison. Talk to them about how the images are not realistic or expected, how its overuse can lead to increased anxiety and depression and low self-esteem, how using social media can lead to feelings of envy and jealousy, and even how it can make you feel as though you're not worthy or as good as other people. So I think it's important to note that we cannot necessarily remove social media from our children's lives, but if we can head off the messages and contextualize them, we can help our kids better deal with whatever it is that they see. Help your daughter value herself based on her unique talents, abilities, and character traits. Take the time to hear what her thoughts, concerns, and fears are. Validate her feelings. Be really careful that the way you speak to her is not overly harsh or critical. Help her express her feelings, but work to help her change any inaccurate beliefs. And like we said, focus on her midos and special qualities. We need to work to foster self-compassion. So it's, you can do this through a lot of different ways, but also talk to your child about her emotions and remind her that emotions and hormonal changes during this period of time are normal and expected, but they can sometimes make things very difficult. So you share with them that you want them to share with you what their feelings, their thoughts, their frustrations, their concerns. Try to create a home environment that is non-judgmental, that is very loving and accepting, and give your child the opportunity to make some of her own choices and take some of their own risks. Of course, you have to do that within reasonable measure for their age and maturity level. But when you allow them to take their own risks and make their own choices, this will reduce their need to take control in other more unhealthy outlets. And of course, make sure your child knows that your love is unconditional. You can say, there are still rules, structure, and discipline in this home, but I love you unconditionally, and everything that I do is for you. And then there is something called the health at every size approach. It's an ideology that is pretty much worthy of an entire presentation, but I'm just going to go through it quickly as we finish up our presentation to highlight what it's about. Health at every size emphasizes engagement in health behaviors and self-acceptance without focus on weight loss or weight as an indicator of well-being. So it kind of works to redefine what wellness is in our weight-obsessed world. So you have the concept of health enhancement, which is paying attention to those emotional, physical, and spiritual well-being while removing the focus from a specific ideal weight. Size and self-acceptance is appreciating our bodies as they are, respecting them, and understanding that there are many diverse body shapes and sizes. The pleasure of eating well. Rather than focusing on weight plans and specific diets, focus on internal hunger cues, satiety, appetite, how to feed our bodies in a healthy, good way. And then the joy of movement. We talked a little bit about this before. Exercise for the joy and good feelings that come from healthy movement, rather than focusing on exercise for a specific weight loss goal. And then the concept of end-to-weight bias, recognizing that there is worth and beauty in every body, and that specific shapes, sizes, and weights that are not indicative of any particular way of eating or level of activity or someone's personality. It's not a psychological issue or someone's moral character. So if you notice any worrisome or concerning behavior, you must be proactive. Even if you are not certain, it's important that you follow up, as early detection and treatment of eating disorders is critical to their ultimate success. First and foremost, trust your instincts as a parent. You know your daughter best. Don't doubt yourself, and don't blame yourself. As you see, eating disorders have a complex onset that is affected by many things. Nothing occurs in isolation, and really blame never serves a constructive purpose. Right away, contact your pediatrician's office or your school's mental health counselor for some referrals. And ask questions. Don't be afraid to ask practitioners and treatment providers any questions you might have. You are your child's best advocate. Take the time to educate yourself and ask those questions. And of course, seek support for yourself, because it's imperative that you practice self-care. Thank you so much for joining me here tonight. And while this presentation is more of a high-level overview of things, there's always more we can do and learn. Atzmi was created to help support the mental health of our girls through programs that support their self-esteem, self-compassion, body acceptance, and reduce the focus on outward appearances. These programs will be implemented throughout their school years and will also involve programs of education for teacher and parents as well.